When you have your own practice, I know it's a big decision because everything's on you. Margin for error is very minimal because we're dealing with life. Two of my family members themselves struggling when they have different wound. If you go
Father, being a great businessman that he is.
trust, never break trust with anyone. Be truthful as if you're treating every patient of yours.
Welcome to another episode of the Middle Hustle podcast. It's fantastic to have Dr. Zafrina Burukan all the way from Malaysia. A truly inspiring person, a longtime friend who I greatly respect and trust. Before I do a disservice on your illustrious career, Zafrina, I'll let you take the center stage. But yes, Assalamu alaikum, Zafrina, and thank you for taking the time and talking to me. So let's start from the beginning.
Assalamu alaikum. How are you, Shafiq? Nice to
Alham-
get in touch with you.
Alhamdulillah, thank you. Yes, I'm good. How's things there in Malaysia?
Alhamdulillah, all seems to be well and good, yeah.
Good, good. All right, Zafrina, like what I said before, let's tell us a little bit about yourself for those who for the little people who do not know about you, which I don't think there are many. So yeah, do you want to tell us a little bit about yourself?
So yeah, hi, I'm Zafrina and a very good friend of Shafiq. Our friendship goes back about 20 years now. I think you know a lot about me more than a lot of my friends as well. A very good friend of mine, as you are, and a very good family friend. Yeah, so as you know, we met before we embark our journey in Ireland. Going into med school, and our friendship grew from there. So I studied at the Royal College of Surgeons, as you know, and subsequently graduated, worked in Ireland, then moved back to Malaysia for a bit after I got married. And then we went back to Ireland and now back in Malaysia. So it's been up and down. I mean, I suppose you've explored the world as well. Yeah, so that's where my career is. And currently, I'm mother of one, a beautiful daughter, a beautiful family. And I own my own private practice and I work as a general practitioner.
Amazing. Now you do a little bit more than general practice as well, don't you? You do something with wound management.
Yeah, that's right. So basically, I decided that when I came back from Ireland, working in internal medicine, hospital-based medicine, coming back to Malaysia, decided to set up my own practice, and it took its own trajectory into where my passion was.
Hmm.
So, seeing different kinds of patient cohorts, I realized wound care is a field where we can make a huge improvement in the patient's quality of life, their outcome, and it gave me a deep sense of satisfaction of helping these patients. So I embarked the journey. I did certificate in wound care, then I subsequently did postgrad in wound care. So I practice as a advanced wound care practitioner as well in my clinic setting.
Yeah. Oh, that's very interesting. Now, before that, what made you become a doctor, Zafrida? I never asked you that question actually. I can't remember asking you that question. But why?
Well, I think yeah, you've never really. I don't think I've even asked you that question.
Yeah, that's right.
But yeah, so I suppose it's the deep passion, the exposure, the home environment. Think a family member of mine, I mean my mom, she had a bit of a medical condition, so when I was still young, and I decided when I was about 4 years old, when she was saved by the wonderful doctors back in India. um, she is here with me today because of how they cared for her at that point of time. So it's kind of a self decision, self-made decision that I want to embark this journey. So I worked hard through my school days to get the scores to be, to achieve and get entry into medical school.
Yeah, yeah, that's very, very inspiring. But I have to say, you started in pre med, isn't it, Zafrina?
Yeah,
I was your senior.
I know you always love to, pull a string on me. So yeah, so basically, because when I'm the first doctor in the family. So to say that anybody to guide me along in which career path, even though I want to be a doctor, there's just a lot of places. I always grew thinking, I'll be in a local university, getting my med school, getting into med school. When the opportunity came for Ireland, I never really thought about Ireland because initially I was thinking of Australia, and so I did, my pre how do you call my I did South Australian matriculation, so then it's a year program. So I think the pre-medical year was kind of a year more of a foundation year to prepare towards med school, which I will never regret. So I think that's how I started in Ireland. Yeah.
Yeah, I really, I like I said, I became. I think you and I, like I said earlier, we had similar beliefs and similar cultural backgrounds. So I think we clicked on very early on in the beginning, didn't we?
Yeah, I remember the days when you used to buy kebabs and halal meat from the halal stores nearby to your place.
Yes, yes, I remember. That's very good times. Good times.
Yes.
Now, were you always wanting to be a general practitioner, or was there something else that you wanted to do?
Think initially, when people when you're growing up, when you see as a doctor, you always think being in a hospital is what being a doctor is all about. And then when you realize in medicine there are very different major pathways that you can take. So having had trained in Ireland, I went through all the rotations in internal medicine, gave me a good foundation. Having worked in Malaysia, I had exposure working in Hospital Kuala Lumpur, the largest hospital here,
Yeah,
and exposure in pediatrics, ONG, primary care after that. So I got a very well-rounded training. So when I came back to Malaysia just before COVID, and I had my child, so I wanted to have a bit of a balanced life. So I wouldn't say, I mean, hospital medicine has no balance, but it's just something that I wanted to do for myself. I wanted to have a bit of autonomy about how I want to treat my patients, how I want to get hold of things. So then I also pursued my master's in public health at the London School of Hygiene and Tropical Medicine. So it kind of worked a lot in, I did a more focused stream in health management and health promotion. So I decided that, having the amalgamation of knowledge from internal medicine and primary care and public health, having my own practice would give me an opportunity to practice the way I want to be and be there for the patients cohort that I want to treat.
yeah, that's very, very inspiring, Zafrina. I know you worked hard. Like I said, off the camera, I know you worked really hard, and it's very inspiring what you've done and what you've become.
You too.
now, you have a you have a practice of your own,
Mhm.
and that probably comes with its own challenges and challenges. What
Mhm.
sort of challenges have you faced having your own practice?
Yeah, I think the decision to set up our own practice did not come as a planned decision. It was very unplanned, in a sense that when we saw a place that was quite suitable, having the confidence to say the full family support, then we embark the journey of setting up the practice. So, setting up your own practice has its own challenges, as you say, you're right, because clinical medicine, yes, we can manage the patients, but the operational side, day-to-day operation is not we did not join hands with multi-chain clinics. We started from scratch as our own solo clinic. And so I think the operational side of managing staff, ensuring their well-being, ensuring the clinic's well-being, day-to-day operation, the doctors who are working in the team. So you have to work as a team. It's like a family, and with a focus that we are all carrying towards the patient's outcome. So we
Mm.
focus a lot on that. We ensure that patients are treated as a family, because when patients come, I usually tell my team that you need to treat them as a family, because you don't want they're already in pain. You don't want to add on their pain, so treat them nicely. It's not just for the sake of just because it's a private practice. We don't want to have a transactional care. We actually focus a lot on relational care.
Yeah, yeah, absolutely. It's like patient care, isn't it? And family practice becomes very you develop a relationship more than hospital care.
That's right. Yeah.
Yeah. I mean, would you advise people to go into general practice?
I would say yes, because as a primary care physicians, I think we have a lot of role for prevention, and with
Yeah.
the health inflation that's skyrocketing here, so we need to be careful about how we are dealing with patients. Not doing unnecessary things, doing what's evidence-based, patient-centered care. For people who want to do general practice, I would say you need to have certain level of clinical understanding in addition to the operational care. Never be worried about seeking out for help. Speak to
Mm.
people who've done it. I usually do speak to my friends who has number of clinics as well. They have certain approach, different ideas, and sometimes they seek our ideas as well. So it's always never like a zero sum competition. It should be like a positive way of dealing to have patients at the core of the center of the business and also the service.
Yeah, because it used to be general practitioner and family medicine was very you felt very isolated.
Mhm.
Then now I think with I mean with technology, everything is well connected. You have to
Yeah,
network as well.
yeah,
Yeah.
that's right. Yeah.
Um, I mean, what's family medicine like in Malaysia?
I mean, if you're talking about family medicine, there's a private side and a public side. So if you're in a public health setting, then you're obviously working under the Ministry of Health, running the primary care services. They have their own divisions under the public health sector, and like maternal child health and outpatient clinics, non-communicable diseases, communicable diseases, as compared to private clinics, where private clinics are owned by general practitioners who possibly have done a little more advanced kind of not necessarily a formal family medicine training, but most of us will have like a diploma in family medicine, or some sort of training in terms of specialized field like wound care or sexually transmitted diseases and things like that. So just like how overseas they would have like their special interest kind of field, pediatrics and stuff. So in a private clinic setting, of course, is currently running on fee for service and also under insurance, and so patients would have insurance under company employment. So based on their benefits, and also we also have something like we call a Madani under the financial aid from the government, so patients can go with from a specific tier of socioeconomic conditions, so they can also seek help from that side. So in Malaysia is moving towards DRG, a value-based healthcare driven outcome-based treatment as well, but it's very much at a very early stage. But I think this is where it will help to reduce the cost for the patients as well.
Sounds very complicated, Zafrina. Anyway,
Every country has their own way of, there's a system, private or public, but this is how Malaysia is.
yeah, no, absolutely. Every country's got its pros and cons. That's did not deny. That's 100%.
Mhm.
No denying that. What did you find most challenging in your career, Zafrida? Like what sort of trials, difficulties?
Well, it depends on which phase and which part of our training. So I suppose the initial part of being in, I mean, if I were to go back in time in Ireland, initial as an intern, I was the first medical on call intern, having the pager, working for team based departments in Beaumont Hospital, which is a hustling, bustling hospital, being in a neurology, neurosurgery team as a tertiary referral center, and then transitioning back to Malaysia, even though being a Malaysian, different work culture, different way of thinking, different way of support mechanism, that was challenging. And then, then going back to Ireland again after we got married, and after a few years, again, adaptability, things evolve, certain way of dealing with things. I was here more in primary care. When I went back to Ireland, I was back in Beaumont Hospital. Again, being in a tertiary medical center is different, so it's a lot of learning curve, adaptability, family support. You're also growing up, families growing, all these challenges put in together, I would
Mm.
say it makes you to the person who you are. And then, of course, deciding to set up my practice, the challenging factors, of course, a lot more long hours, because, you're also not just dealing clinically, you're dealing with the day to day operation. So stepping away kind of from your clinical side, the moment a few hours are, when another doctor steps in, then you're kind of dealing with the operational side, meeting out suppliers, how to enhance it, because we're always looking at quality improvement with anything that's happening, so that we are giving the best care for the patients.
Mm.
And then, of course, patients come in with a trusted relationship. We work hard to ensure that the trust is always there, to know that we are there for them at any time. And it's purely because the relationship that we've created with these patients, with our community. We're very proud to say, I think, we can pledge ourselves and say, yes, we were even awarded as a best family friendly clinic. I don't think it's just the award, but I think it's the recognition and the trust that we've created within the community. I
Absolutely. Yeah. Yeah. That was yeah, I was just gonna come to that. What was your biggest successes in your career? What were your successes in your career?
Successes.
Yeah.
I suppose it's a different phase, because I also get involved in research. So I don't just sit in the clinic. So a lot of my patients will be wondering, where did doctor disappear to for a few days or a few things. And then, it's not that, sometimes they'll think that I have another practice. No, I don't have another practice, but it's purely, I always believe that if you just sit in and not update yourself or get involved in research based work which enhances the patient outcome, then there could be a pitfalls there. So my successes would be, I think, to be able to stand there to say, I've actually, I can always go home and sleep peacefully, to say that I've done what I can for the best for my patient, or seek help whenever that's needed. I think knowing that not we know everything, and knowing when to put a line and say no, we need to seek a second person's opinion, or expert matters opinion. I think that's my success.
Yep. Yep. That's good. I mean, now coming back to a little bit of I mean, being a mother, working, full-time doctor, that's a huge success in itself.
Thank you.
Thank you. And you are traveling quite a bit as well, Zafrina. Every time you're a difficult person to get hold of.
No, no, I think you're equally same.
No, lah, no. You no such thing. You are a very difficult person to get hold. Anyway, but still, you still manage to find time. You
Thank
still
you.
manage to find time. Now, I know your father. Your father looks after what's this? Nasi Kandar, isn't it? Nasi Kandar, Penang. Am I saying it right?
Original Kayu, Penang.
Original Kayu. Now, that's a big family business all over Malaysia. Has that influenced you in any way?
In terms of business acumen, maybe I've
This,
grown up seeing my dad, my grandfather, in different roles in a business thing. But I think what I think the one thing that I hold on very very strongly to me is the word trust, and also not to ever break the trust. So that would take you a long way, more than any of this. So we don't go on crazy marketing gimmicks or anything like that. I think word of mouth is more than enough if they trust us. Whether it's patients, or for my dad, for his customers, the quality of care or the quality of the food. So first, you maintain the quality. Two, clean words. Don't give them empty promises, and also, of course, number three, just don't break the trust. I think that takes us a long way. That's one thing that I've learned from him. And he's one person. He's constantly moving. He's constantly being there for his team. All his staff, for his customers. So I've definitely learned a lot from him.
yeah, and you do have robots in your father's shop, isn't it?
The robots were there because my husband procured it for him during the time of COVID. But unfortunately, I think in a clinical setting, not much that, I mean, not this kind of robots. Of course, there's a lot of robotics already taking over surgical procedures. But yeah, I'm sure you were served by the robots too when you were here, Shafiq.
Yes, yes. No, I just thought I'll bring that up. Just
Yeah,
being cheeky. I'm just being cheeky. I'm just being cheeky, Zafrina.
yeah,
Anyway,
Shafiq and I, we go a long way. He will
yes.
stop smiling if I start talking.
Okay. All right, Zafrina. Now we'll talk a little bit about now cost of living. It's high for a lot of people, like you brought up much earlier on. Inflation is
Mhm,
it's becoming very high. It's making things difficult. In
mhm.
your view, how is it there? How is it Malaysia? How are you dealing with the cost of living? How are you dealing with inflation, especially from a family setting? and also from a business side?
Mm-hmm. So yeah, I think cost of living is increasing. I think it's a very well known fact, especially in medical line. So I think what is important is to be to do things that's absolutely right for the patient, not unnecessary doing things just for the sake of getting things out for the patients there. So I think we can, as doctors, we can help. I mean, medical school always taught us to prescribe and to diagnose according to justification of why you're doing certain tests and why you're giving certain medication. I think that will help in terms of knowing and having a good communication with the patients. So we are not unnecessarily doing unnecessary tests, and that would reduce the cost. And to be able to say, if you have the medicine at home, then you probably don't need any more from our side. So understanding what patients actually need, not just throw them the medications unnecessarily, I think that would itself help. Of course, we need to be vigilant, the proper procurement into what we are purchasing and how we are dealing with things would also help.
Yeah, and in terms of lifestyle, like what sort of strategies are you like sort of trying to overcome them, or sort of not overcome, just trying
Mhm.
to maneuver around it, lah?
I would say, I mean, not exactly any specific strategy, but I think a good communication helps for them to understand, don't unnecessary expenditure, and of course, medication options are there, whether you have generic or original medication, as long as the efficacy wise is good, it's helping the patients. I don't think there's a choice, just a matter of brand. You have two brands of handbag, both have the same function, so it's a choice of making which handbag you want to. I don't want to call out any specific brands, but you know what I'm
Yeah,
trying to say. So I think it serves the purpose, and
yeah,
also to know, to be vigilant about how your expenditure is. It comes down to the individual's choices.
yeah. I think that's a fair point. I think it's everyone says the same thing.
Mm-hmm.
Yeah. What's you are a specialist in your field. Especially, I'm very interested in this wound management thing. Like, do you
Mm-hmm.
have any? What's your general advice on that? Like, any tips that you can share that I can carry with me about wound management?
Yeah, so wound care has different types of wounds. So people think that it's just a conservative gauze and bandage and some antiseptic, and that's done. But actually, if
Yeah,
you look into the wound care, it's a huge involvement in this industry, because there's advanced wound care products.
yeah,
There's adjunct therapies that we can use for chronic wounds. So if the main thing is not knowing what is available out there makes doctors to practice wound management in a conservative way, which can end up causing a huge delay in the wound progress, in a wound healing, which will impact the psychosocial status of the patient, costing, you're going to heal the wound longer, which means going to end up costing more visits to the clinic. So what we tend to do, with the proper advanced wound care, is that you're using products by evidence based. So you're looking at the proper time concept. You're speaking just as much as evidence based, wound care management, where you're looking at the time concept, the moisture of the wound, selecting the products based on the exudates. For not a medical jargon, what I'm trying to say is knowing what kind of product to use comes from the training and the knowledge, and then knowing when to draw a line and to refer early, because you don't want to be holding on to certain wound that is ending up with, the main aim is to save the limb, to enhance the wound healing, close the wound in a proper clinical manner, so that patient does not end up with complications or delayed wound healing. So qualitatively, when we speak to the patients, it has a huge impact, not just for the patient, but also to the family, because they could be the breadwinner, they could be avoiding work, they won't be able to go to work during that phase of time if the wound is at the heel, those kind of things. And proper, like for example, diabetic wound, which has on the sole of the leg, you need to have a proper footwear, because if not, the wound will not heal. Proper nutrition, to proper sugar control. So it's not just a single management with just wound product. So as a clinician, we are bringing in all our knowledge and to help to heal the wound, to get back to the patient's capability to be back to their normal day-to-day work.
yeah, yeah. Well said. I 100% agree. I agree
Yeah.
on that. Okay, just a few more questions, Afrina. You okay?
Yeah, I'm fine. I'm used to
Yeah.
getting business from you, Shafiq, so it's fine.
Okay. Now, we we cannot be difficult to predict the future. We not we have to trust in Allah subhanahu wa ta'ala because he's the best of planners. But what's a decade, 5 to 10 years in your view? what's it going to look like in society, in healthcare? Well, what do you think in your view?
Yeah, I think medicine is always an evolving field. I mean, if you take about 10 years ago to now, to what we studied when we graduated to what is available now, it's going to evolve. Yes, we know a lot of AIs and all this telemedicine is taking over. But at the end of the day, I think what can never take over is the human touch, the way we communicate, that can never be replaced. I think things and technology will advance for the best of patients' care. That's always happening. What we learned of medication that was available a few years ago, then when we faced a pandemic, things evolved very, very quickly. The way we, day-to-day work, people never used to hear the work from home. Of course, it does not apply to our kind of industry, but I see the flexibility that people have now understood that certain work can be done from home. I think that has even education, so what we see in future, probably there are a lot more technological advancement, but baseline, whatever said and done, the human touch when you're breaking a news to the family, or communication, the touch or the empathy, that will always be coming directly from us as practitioners.
Well said. Well said. And in society, how do you think society will look like? With how it's very depressing seeing how the world is going right now.
Mhm.
There's struggling and people are dying. It's very sad to see what's happening in places like in Gaza and Palestine and Sudan. At this point,
Yeah,
what are your thoughts on that?
I think an open mind.
Yeah.
I think the new generation, I think they know what they want. I think children these days, they are very vocal. As we can see, our children, the way they think, the way they talk, I think they understand that the world has no boundary, and they all strive to be there for each other with the SDG goals. They're all learning all these things, which probably not much of emphasis was given during our time. I think putting all that together, the world will come closer, and everybody will strive towards the peace. There will always be these challenges, but if our new generation, our children, face the world in a more peaceful manner, I think
Mm.
this can be, we can overcome this.
Very, very well said, Zafrina. Well said. Now, if you were able to go back in time, which is not possible, but if there was a way, and if you were to go back to your high school days, what would you have said to yourself?
I think from a traditional, I think the education now has opened up a lot more. You see, like I can see students are a lot more into inquiry-based learning. And that's a new, we did not have that opportunity with gadgets and these programs. Of course, with limitation, of course, we also see the negative side of having accessibility to a lot of social media. So, those kind of things, cyberbullying, all these things putting aside, I mean, we need to counteract. Maybe at that time, if we had that opportunity, maybe our knowledge in terms of the global knowledge could have been slightly different, because it gave us more medium of learning. We only went back to school textbooks. So internet came in slowly over like early 90s, as we evolved through education. Of course,
Yeah.
and beside, they gave us the gadgets early with Apple laptops and stuff. But what I would say is, going back to school, I would say
Well,
a
yeah.
little bit more exposure to the world rather than a traditional schooling, which has evolved now.
So you would say to yourself, "I wish I had more exposure to the world when you were in high
At that
school."
moment, yeah, I think that would have been a different way of learning those days. Yeah.
Oh, really?
Mm-hmm.
Oh, that's I've not heard of that, but yeah, that's interesting.
Because I think we were more on, I was in a public school, so maybe you can.
Yeah.
So I mean, it's a very good education system. I would not go against it. I still like it. It made me who I am today. When I went to Ireland in the first few years, I remember, the knowledge that my friends from Canada or North America, or even Irish people, friends from, the Western side, they had a lot more outside book knowledge, so which I thought at that initial years, it used to be a bit of a struggle to understand. So of course we had a lot of reading materials, but I think it's just the context of school, so we were used to more like traditional schooling, school-based learning, co-curriculum activities. but they had a little bit more exposure. But now when I see my daughter, or the even my, my younger cousins and stuff in school, they are getting a lot more exposure to the real world, which I think would make them a better person as well.
I think I understand what you meant now. Yes, I think I agree with you because back then we were just very, like you said, very traditional. Everybody was just very focused on theoretical knowledge and just read your textbooks, read your this, go for tuition, come back. But we were not very exposed to the outside world. We were just very like, how you call that? As a Malay proverb. I'll translate what kata di bawah tempurung,
I'm
isn't it?
very proud of you, Shafiq.
Thank you very much. Thank you. Okay, thank you. Which meant, if you translate that in English for those who don't understand, it's like a frog under cover. Is that right, Zafrida?
It's like you're just trapped in your own world. You're not
Yeah,
actually to the
you're
outside
trapped
world.
trapped in your own bubble.
Yeah, own bubble.
Yeah, no, that's true. That's true. I mean, but I think that by that time there was not much of, it's not like now information is so easily accessible. Back
Yeah,
then it's not. You still had to go to the library, look through an
yeah.
encyclopedia, and go
Videos
through
and
all
stuff.
that.
Yeah.
Whereas now it's waste of time. Now AI is there as well.
Correct. Yes. So the
Okay,
information overload, I mean, but the only challenge now is that time we did not have that much information. Now we have overloaded information where we need to synthesize and pick up the correct things.
correct. Yes. Now, is there anything else that I've missed that you wanted to talk about, Zafrina?
Yeah, I think you've done well. I am very proud of you on this your journey. I think it's going back to our, the way myself and Shafiq's your friendship is. We've always been very spontaneous. To have a wonderful, I think congratulations. I think we learn a lot more in depth listening to your previous podcasts and things that we
Uh,
never thought through. So I'm very proud of you, and keep it going. Yeah, thanks for the opportunity.
Thanks, Zafrida. Like I said, I've just started this. Let's see how far it goes, how where it takes me. But starting off small, inshallah. Let's see
Inshallah.
what Allah has planned for me.
Inshallah.
Inshallah. Thank you, Zafrida.
Most
Jazakallah khair for doing
thanks
this for
so
with
much.
me.
No
I'll speak.
problem.
I'll be speaking to you after this.
Yes, thank you.
Thank
Have
you.
a good day.
Wa alaikum salam wa
Yeah,
rahmatullah.
bye.